Hi, my name is Denise. We're going to be doing a knee trigger today. We're going to do 5 projections. We're going to do the AP knee, the oblique, and the lateral. And we're also going to do the AP axial and condylar fossa, and we're going to do the sunrise patella as well projection. And that's a tangential projection. And now I'm going to go grab my patient. I set up the room and then grab the patient. Right this way, ma'am. May I have your first and last name?
It is Sylvia Lopez,
And your date of birth?
10/27/84.
Okay, Mrs. Lopez. And what brings you in today?
I was playing soccer and I got hit right below my knee,
Okay,
the cleat to the knee.
I'm sorry. And do you have any history of cancer?
No.
Any prior surgery?
No.
And is it your right or your left knee that hurts?
My right knee.
Your right knee? Okay, and is there any possibility that you could be pregnant?
No.
Okay, so I'm gonna have you put this on, please, and take everything off from the waist down, and then I'll meet you back in the room so we can start the x-rays, okay?
Okay.
Okay, thank you. Okay, Mrs. Lopez, so we're gonna do a projection, an AP projection of your knee, okay? So we're gonna take the first x-ray, and I have my light collimated to a 10x12 imaging plate. I have my right marker right there, and the tube is angled at 3 to 5 cephalad, and the central ray is right here. It is half an inch below the patellar apex. She is shielded, so we have the shield right here, and she is all ready to go for the AP knee. And now we're gonna go shoot our x-ray, and the SID's at 40. Okay, perfect. So then the technique that we're going to use for knee is 70 at 5. Okay, Mrs. Lopez, can you please take a big breath in and hold it? Beep. Okay, you can breathe and relax. Perfect. And then we're going to come over here, and then we're going to shoot the next image. We're going to take out the plate. We're going to go over here, and we're going to run it. Grab another one, and then put it in, and get her ready to shoot the next image. Okay, Mrs. Lopez, now we're going to take the second x-ray, and we're going to be doing an oblique knee with medial rotation. So we see that her foot, it is rotated 45 degrees medially. We have our right marker, once again, right here, since we are doing the right knee. The tube is angled 3 to 5 cephalad, and our central ray is entering at half an inch below the patellar apex. And she is shielded, and we are all ready to shoot the x-ray of her AP oblique knee with medial rotation. We're going to go back, and we're going to go over here and shoot the x-ray. Okay, Mrs. Lopez, can you please take a big breath in, and then the technique that we're going to use is 70 at 5. Okay, take a big breath in, and then hold it. Beep. Okay, and then now we are gonna come over here, and then we're all done with this image, okay? Okay, so now I'm gonna be shooting a lateral knee. It's a medial lateral knee. And we have our marker marked right there for our lateral knee, so it's the right. And we collimated to a 10x12 disc, and we have the central ray, 1 inch distal to the medial epicondyle. Our tube, it is 5 to 7 degrees cephalad, and we shielded our patient, so she's all shielded. And now we're gonna go over and shoot our x-ray. My technique that I'm gonna use is 70 at 5, and now I'm gonna shoot it. Okay, Mrs. Lopez, can you take a big breath in and hold it? Beep. Okay, and then we're gonna go back. You can breathe and relax. And we're all done with this projection. Okay, so we're going to be doing an AP axial intercondylar fossa projection, and we have our right marker because we're doing the right knee. She is shielded, and we collimated to a 10x12 lengthwise, and our tube is perpendicular to the lower leg, and our central ray enters perpendicular to the long axis of the lower leg, and it's entering the knee joint half an inch below the patellar apex. And we are ready to go. Our SID's at 40, and the bucky's lined up to the tube. And we're going to be using a technique of 70 at 5. And okay, Mrs. Lopez, can you please take a big breath in and hold it? And then beep. Okay, you can breathe and relax. And then we are all done with this projection. Okay, so now we're going to be taking an image of the tangential patella, and it's the Suttergas method. So we are using a 10 by 12 disc, and we're using it lengthwise. And our patient, she is laying on the table, her knee is flexed 20 to 30 degrees, and she's holding onto the plate for me. And there is typically a 15 to 20 degree undulation of the tube, and we're going to collimate 4 by 4 inches of the plate, since we're only going to get the patella in there. And the central ray is perpendicular to the joint space between the patella and the femoral condyles when the joint is perpendicular. Okay, so we shielded the patient, and we have our marker, everything's all ready to go. So we're going to come over here, and the technique that I'm going to use is 70 at 4. Okay, Mrs. Lopez, can I please have you take a big breath in, and then suspend and hold it. Beep. Okay, we're all done. Thank you. Thank you, Mrs. Lopez. We are all done. I'm going to walk you out to the lobby, and you are free to go. Thank you. So this is the image of the AP knee that I took on Miss Lopez. So the evaluation criteria for an AP knee would be evidence of proper collimation, which you can see on the image, knee fully extended, if a patient's condition permits it, which it did, entire knee without rotation. In this, for example, it would be femoral condyles symmetric and tibia intercondylar eminence centered, slight superimposition of the fibular head if the tibia is normal, patella completely superimposed on the femur, open femoral tibial joint space with interspaces of equal width on both sides if the knee is normal, and soft tissue and bony trabecular detail. And this is my AP projection of the knee. This is the AP oblique knee with medial rotation, and the evaluation criteria for an AP oblique knee with medial rotation would be evidence of proper collimation, tibia and fibula separated at their proximal articulation, posterior tibia, lateral condyles of the femur and tibia, both plateaus, margin of the patella projecting slightly beyond the medial side of the femoral condyle, open knee joint, and soft tissue and bony trabecular detail, which is so shown on the image. So this is the image of the lateral knee, and the evaluation criteria for a lateral knee is evidence of proper collimation, knee flex 20 to 30 degrees in a true lateral position as demonstrated by the femoral condyles superimposed, fibular head and tibia slightly superimposed, and patella in a lateral profile, open patellofemoral joint space, open joint space between femoral condyles and tibia, and soft tissue and bony trabecular detail. And this is the lateral knee. This is our AP axial projection of the intercondylar fossa, the Beclaire method. The evaluation criteria is open intercondylar fossa, posterior inferior surface of the femoral condyles, intercondylar eminence and knee joint space, no superimposition of the fossa by the apex of the patella, no rotation as demonstrated by a slight tibiofibular overlap, and soft tissue and bony trabecular detail. So this is our image of our tangential projection of the patella. The evaluation criteria is evidence of proper collimation, patella in profile, femoral condyles and intercondylar sulcus, open patellofemoral articulation, and soft tissue and bony trabecular detail.